What's up, everyone? This is Dr. Webb here. Today, I'm going to be talking about the different specialties that you can go into in medicine, and I'm going to give you guys my thoughts on which specialty is the best. I may be a little bit biased, but I only can speak about from my experiences when I was in medical school, rotating through the different specialties, and also during residency, kind of interacting with the different specialists. So in your fourth year of medical school, you apply to different residency programs. If you want to go into neurology, you apply to neurology programs. If you want to go into anesthesia, you apply to anesthesia programs. And whatever specialty you want to go into, you have to apply and you have to interview, just like you interview for medical school. I was interested in orthopedic surgery, so I applied to 80 programs because I knew how competitive it was, and I went on about 15 interviews for orthopedic surgery. I interviewed at Stanford, I interviewed at Harvard, I interviewed at Baylor, Northwestern, Cleveland Clinic, a lot of big name programs, and I was very fortunate to interview at those places. But whatever specialty that you go into, one of my professors in medical school kind of broke it down, and he basically suggested that you have to figure out what's most important for you, whether that is prestige, whether that is pay, whether that is lifestyle, because some specialties have more time off, like pediatrics, but you don't get paid as much. You may get paid $200,000, $150,000 a year. Neurosurgeons make $700,000, $800,000, up to $1 million per year, but you will work a lot. So you have to find out what's important for you and kind of put that into your equation when deciding which specialty to go into. There are lots of different disadvantages and advantages to certain specialties, like surgery. Like I said, you will work a lot of hours. As a resident, you have to go through anywhere between 5 and 8 years of training, sometimes longer, to become a fully fledged surgeon. And your hours in residency and after you get done could be, anywhere between 60 to 90 hours a week. That's just a typical lifestyle of a surgeon. If you go into anesthesia, which I think is a good field to go into, residency is 4 years. You do make good money, but I think one of the downsides is that anytime that the surgeon is there overnight operating, there has to be an anesthesiologist. So you will have to work, quite a few hours, kind of like a surgeon, because anytime a surgeon is operating, we need the anesthesia to put the patient to sleep. Pediatrics, I think pediatrics is a good field to go into, but if you're coming out of medical school and $300,000 in debt, you may want to, reconsider pediatrics. I'm not saying it's impossible, but you may have a little bit of a hard time paying back your loans, only making $180,000 a year, $150,000 a year. Residency is only 3 years, and you have a pretty good lifestyle. Orthopedic surgery, I think, is the best specialty out there. I may be biased. We do fairly well coming out of residency. Most people specialize. About 90% of people specialize, so they do an additional year of training in addition to the 5 years of surgery training. So it's 6 years total after medical school. But your lifestyle kind of depends on how much you want to work. You can go into sports medicine, where you work with professional football teams. The Spurs doctors is he's an orthopedic surgeon. The Redskins doctor is an orthopedic surgeon. Most doctors for these teams are orthopedic surgeon, sports medicine trained. You can go into spine surgery, you can go into foot and ankle, you can go into hand surgery. So lots of different subspecialties and orthopedic surgery, reason why I think it's the best specialty. So when you are in your fourth year, or if you're in pre-med and trying to figure out what to do, just figure out what's most important for you. What will make you wake up every morning and want to go to work, instead of waking up and having a hard time getting yourself up to go see some patients or go to work. So find out what's most important for you, whether that's prestige, whether that's money, whether that's lifestyle, and then choose that specialty. And there are lots of different outliers out there. Be a neurosurgeon, you can work as much as you like. You can go to medical school and then get your, become a neurosurgeon and work 40 hours a week if you want to. But that is not the norm. So just because it's a surgical specialty, that doesn't mean you have to work 80, 90 hours a week. Your lifestyle will be a lot busier than other specialties, but it's what you make of it. You can work part-time if you want to. So those are my thoughts on different specialties. I think orthopedic surgery is the best one, so really consider that. If you don't have a rotation at your medical school, or if you're an MP or a PA, if you are a LVN, RN, and you want to get into orthopedics, you just have to seek it out. I do plan to hire a nurse practitioner and or a PA to work for me once I'm done. So I think that is a good route to go to. If you're considering a lifestyle that you can have some time off, you don't have to be on call like a MD would. Nurse practitioner or PA school is a good route to take. If you guys have any more questions, email me at overcometheoddsbook@gmail.com or hit me up on my website, AntonioWebbMD.com. See you next time.